Hi, I'm Professor Viviana Wuthrich from the Centre for Ageing, Cognition and Wellbeing at Macquarie Uni. I'm a clinical psychologist, and so a lot of my research projects are related to understanding mental health. I have some pretty cool projects I'm doing at the moment, which are clinical trials where we're trying to establish the effectiveness of a new psychological treatment to treat anxiety and depression in older people. What's cool about these projects is that we've been developing an internet intervention and a telephone-based intervention, as well as some face-to-face interventions to try and improve the effects that we get when we treat older people with anxiety and depression. And the cool thing about developing some remote interventions is, of course, this means that we can increase the access for older people who might live in rural and remote areas, or who might not be able to leave the house to go and see a psychologist due to health issues. And of course, given the COVID-19 period we've just been having, it's been very timely to be able to offer these sorts of interventions to older people. So in these particular projects, we're comparing to see if these new interventions are better than what older people would normally experience if they were to get treatment from a psychologist. Because we're actually interested in increasing access, we've been doing this with older people who live in Sydney, both at the Royal North Shore Hospital and the Prince of Wales Hospital, but also people who live out in Orange, Dubbo and Bathurst. And so one of the great things about this project is that we've had to go out and visit these places. Our team, we've had a couple of road trips out in the Orange, Dubbo and Bathurst area, which has been lots of fun. We've been out there training clinicians about how to use these interventions and to conduct our study. So this project's actually really important because older people tend to be neglected. Their mental health needs are often ineffectively treated. And so this project will actually help us to treat these people more effectively. And that's important because when older people don't get treated, it can actually increase their risk for developing dementia, for developing health issues, and for premature death. So in fact, it's really important we get better at helping older people to recognise when they are struggling with anxiety and depression and to get them treatment. The other fun thing that's been happening with this project is that as part of the internet intervention, we have engaged 2 older Australian actors to help us to play the characters of Frank and Deidre. So that is Nolene Brown and Gregory Ross, who have been very kind in dedicating their time to play these characters for us. But of course, we've done some of this filming during the COVID-19 period, and so it's been quite challenging. And we've actually had to do some of this filming using smartphones, which is not quite what we had intended to do originally. Anyway, I'm very much looking forward to the results of this trial and hope that these new interventions will help improve treatments for older people so that we can just, do a better job as scientists. Thanks.